Postpartum depression comes in various forms. Many people believe that postpartum depression is seasonal depression or unreal. Some even believe most mothers are just tired from having a schedule change. However, that is all factored in with postpartum depression. There is a schedule change to have to get up every 2 to 4 hours, missing sleep, worrying about baby, cleaning bottles, and so much more that comes with new parenthood. With all developmental changes come. But there are different depressions surrounding pregnancy that can be identified by speaking to a doctor, counselor, or midwife. Taking care of oneself becomes harder, but it is important to make sure it gets done. There is perinatal depression, postpartum depression, baby blues, then there is postpartum psychosis. Self-care is important for new mothers, which the difference between baby blues, postpartum depression, and postpartum psychosis can be learned by talking to a midwife, doctor, or counselor so you will not mistake them for just signs of fatigue. Perinatal depression, which is described as a prevalent and potentially severe mood disorder that affects approximately 1 in 7 people during pregnancy or within the first year after childbirth. Carlson K., Mughal S., Azar Y., and Siddiqui W. stated this in 2025. Symptoms may include depressed mood, loss of interest, sleep disturbances, psychomotor retardation or agitation, worthlessness or guilt, loss of energy, suicidal ideation, impaired concentration or indecisiveness, and or change in weight or appetite. This may sound like general depression, however, it goes so much deeper than that because it starts off so soft and feels like just an off day. But that off day can quickly turn into an off week, and so on. It is very important to notice the signs and catch them in the beginning so proper treatment can be given. Postpartum depression is commonly known as a sad and unstable mother that is unable to see past her emotions to tend for her child. However, even though that can be the case in some circumstances, it is not the standard depression. According to Guan Lina, postpartum depression is a common type of psychiatric disorder during the postpartum period. It significantly affects the mental and physical health of new mothers and has long-term negative effects on the growth and development of infants and toddlers. Like all other depressions, it is situational. It is known that a mother just had a baby, but what else is happening in her life? Treatment needs to be based on what the circumstances are in new mom's life. Symptoms of postpartum depression are feeling sad or hopeless, crying more than usual, worrying or feeling overly anxious, oversleeping, concentration problems, experiencing anger or rage, having trouble bonding with the new baby, persistently doubting your ability to care for baby, and thinking about harming oneself or baby, according to the American Dental Association. Catching these signs are important as well because you can get treatment by speaking to someone who is licensed. They can prescribe any antidepressants that may be needed, or they can get a referral to a licensed therapist. In some cases, antidepressants can do more harm than good, especially with someone who is having harmful thoughts. Baby blues is a mild form of postpartum. These symptoms are temporary. They are mood swings, tearfulness, difficulty sleeping, self-doubt, appetite changes, fatigue, and anxiety. These symptoms are usually short-term and only last up to 2 weeks after baby is born and usually requires no treatment. But it is recommended to speak with someone about these symptoms, just so it is noted that these symptoms have been observed. And the licensed specialist can keep an eye on the symptoms in case they worsen. Postpartum psychosis is rare. In fact, experts estimate that it affects between 0.089 and 2.6 out of every 1,000 births in the United States. Symptoms include hallucinations, delusions, mood changes such as mania, depersonalization, disorganized thinking or behavior, insomnia, irritability or agitation, and thoughts of self-harm and harming others, especially their newborn. This is the highest level of postpartum depression, seeing the extreme difference in symptoms. Even though it is rare, it happens. Treatment is required for postpartum psychosis. Now that the differences have been stated and how to identify the symptoms, treatments for these vary. Baby blues is the only one of these particular depressions that medications are not warranted. However, depending on the severity of depression, all of them need an antidepressant prescribed by a doctor. Many people know depression is a possibility to every new mom, but do most people know the symptoms and treatments for depression? What are the triggers or who they speak to? Even though every mother is different, what can be done to help the adjustment be as smooth as possible? Just because it is depression doesn't mean it gets the same treatment. It means it was identifiable, and depending on the severity of it, it can be treated. It is important to act fast. Postpartum depression is silent in the beginning stages, so the symptoms are often overlooked. On the outside, I tried to keep it together, but it felt like he was someone else's kid I was babysitting, according to Janelle in 2018. For the most part, everyone's initial feelings of postpartum starts off the same. A slippery slide that no new mother notices, a slight change in the mood, a feeling of tiredness that they can't shake, a little mood swing here and there that they blame on hormones. But keep in mind, these are the first signs that allow a new mother to know that she should be speaking to someone. Every mother tries to be super mom, but they believe life continues as normal and they will eventually climb out of their slump and go back to their happy lives. However, in some cases, treatment and medication is required, and prolonging it can be detrimental and in some cases fatal to mother and baby. Most people confuse postpartum blues and postpartum depression because the symptoms look similar. However, it is just that they look similar. But these mothers are having very different feelings based on what they may have been diagnosed with, and they are treated differently. Although they are both triggered by having a baby, baby blues is much shorter and cures itself with, at most, counseling. While postpartum depression is treated by giving an antidepressant or referred to counseling or therapy, it is not seasonal depression where if it gets warm outside, all of a sudden the mother feels better, because no matter what, having a baby can trigger emotions that a new mother did not realize she had to learn to control. Perinatal depression in most cases can be treated with counseling and cognitive behavioral therapy as well as interpersonal therapy, which have both been proven to be successful with the use of selective antidepressants. They all have the same trigger but are very different and holds no comparison to postpartum psychosis, considering that is the most aggressive form of depression on this scale, treated by medications and psychotherapy. In conclusion, there are different forms of postpartum depression. Some are more mild than aggressive, but to be able to identify them and knowing what to do in certain situations with a new mother can possibly help her feel more comfortable speaking about it and knowing where and how to get help in case she needs it. Knowing the difference between postpartum blues, postpartum depression, perinatal depression, and postpartum psychosis could help a mother and her baby. Every depression involving a baby is not the same. These symptoms can start while mother is still pregnant and can progress into something horrible, and it mostly always start off with the mom thinking it was just an off day. Know the difference. Feel something, see something, say something. My name is Robin Bell. I am currently a student at Ivy Tech Community College. This was written for my English composition 111, and my professor's name is Stacy Coffey. I am turning this in May 10th at 11:14 p.m.